Welcome to the half hour to health. Okay, stretching and flexibility. The tough part is no one's going to do it unless you know why. Let's look at health. Ideal, move well, eat well, think well. All of these have to do with stretching. It has to do with brain function. It has to do with immune system. That's a heck of a lot more important than good physical performance for an event. Wellness results from purity and sufficiency. Just lock that into your memory banks. All disease comes from deficiency or toxicity. And most diseases or most stressors can be boiled down into three different types: physical, chemical, and emotional stress. So if you can understand physical, chemical, and emotional stress, your body responds the exact same way to all three of these. So if you're... I just did that because I know you can handle it. If you're emotionally upset, okay, right there, you were scared. I know you weren't, but most people would have been. Okay, right there, under that perception of stress, your body responds like you're being chased by a tiger. So you perceive stress. It's the same as if you're in a small fender bender. A small fender bender is the same as if you're chemically attacked. Now, you might have heard of non-steroidal anti-inflammatories, Advil, Motrin, Tylenol. Has anyone ever heard of those drugs? Okay, well, all of those drugs are linked to non-Hodgkin's lymphoma, which is a type of blood cancer. All those drugs weaken your immune system, and they're all toxic to your system. They will cause kidney damage or liver damage. So, is that a chemical stressor? Yeah, absolutely. Okay, commercially produced meats. Again, chemical stressor. They're loaded with pesticides. They're loaded with antibiotics, hormones. It's toxic. So these chemical, physical, and emotional stressors are huge. But the physical stressors is what we're going to talk about a lot tonight. Now, computer work. How many people have ever worked on a computer? Horrible position. Now, if I said that I golfed for 5 hours yesterday and my back was sore, you'd say, of course, you're swinging a golf club for 5 hours. Does that mean that when you bend forward, turn, and twist, the pressure on the L5-S1 disc increases 8 times normal? So you would say, heck yeah, golfing for 8 hours a day or 5 hours a day should hurt, right? Doing what this gal is doing right now increases the pressure on the disc 5 times normal.
What's she doing?
Sitting. Okay? But you don't think about it, because sitting, what that does, that reverses the discs in your low back, flattens out the curve, forces that disc material back in the back half or posterior aspect of it. Also, it throws the head forward. Now, office workers, carpal tunnel syndrome, ever heard of that? Servogenic, it begins from the neck. It's called a double crush injury. That's why 80% of the time, if they do the surgery in one hand, they got to do it in the other hand. That's dumb. Okay, they're missing the source of it. Headaches, most headaches, 93 to 97% of headaches are servogenic. Migraines are servogenic. All of these, servogenic means it begins in the neck. So this results from that seated position. Now,
so what do you do if you have a job you have to sit at?
You fix it.
How?
I'm going to show you.
Okay.
Okay. Like this right here. This is called a reverse curve of the neck. This patient actually had headaches, migraines, and carpal tunnel syndrome. Do you see a difference in those two x-rays? Yeah, this is called reversal of disc degenerative joint disease. Okay, this is a correction of a problem. Does that make more sense than covering it up with a medication? It does, but now if she has an office job, and she actually did, she's a court reporter, so she's sitting down going forward. If you're always in this biomechanically incorrect position, you're going to have to do certain exercises to maintain it. Does that make sense? Now, here's a question for you. If you're sitting up straight and your head's forward, how many pounds does it increase the pressure on the disc in the neck? Anybody know? I know, it's one of those trivia questions. It might come on, okay?
2 pounds.
For every 1 inch the head's forward, the pressure doubles on the disc. Doubles. So now if this is a normal spine, for every 1 inch the head's forward, pressure doubles on the disc. Normal head weighs between 12 to 15 pounds. So if you're only an inch forward, that's 30 pounds of pressure on the disc. This patient here is about 2.5 inches forward. The pressure on the disc in this person here is about 60 pounds. That's horrific. What does that do to the disc? It literally crushes the disc. It destroys them. But also, yes?
This one has more weight on it than that one?
No, this is normal. It's balanced. It's like a bowling ball. This head is forward. So if the head's forward, for every 1 inch the head's forward, the pressure doubles on the disc. But now look at this. Have you seen anyone with a bump here? Yeah, some people call it a buffalo's hump. Some people call it hyperkyphosis. What happens is that's like a fulcrum in a lever. If you see this, that's an incredibly dangerous situation because that's the nerves that come out and supply the heart and lungs. So anyone with forward head carriage, could they have cardiac arrhythmias? Yes or yes? Oh yeah, absolutely. This is an incredibly dangerous circumstance. Now, the body, brilliant. Is the body smart, built by God? Okay, good, just checking. Okay, now, for every 1 inch that heads forward, the pressure on the doubles on the disc. What do you think the muscles are going to do if you have this type of situation? Those muscles are going to be an incredible spasm to pull it back. Now, how do an ignorant but well-meaning physicians treat a tight muscle? Yeah, muscle relaxant, good. Go to an ignorant chiropractor. What'll they do? They'll massage them. Ice, why not? You know, they'll do anything to relax a muscle. Now that's kind of foolish because if these muscles are screaming to take pressure off the disc to save your life and you relax those muscles, which way does the head fall? More forward. Yeah, foolish response. This is the key. Move well. Move well oxygenates, circulates, and stimulates. Now, in every human body, you've got a pump. Okay, this pump pressurizes the blood system. Okay, that's pretty neat, huh? You have 4 times the amount of lymph that you do blood. Now do me a favor, sit up nice and straight. Okay, just roll your shoulders back, just like this. Just about 10 of them. As high as you can, as back as you can. As high as you can, and back as you can. What you're doing now, you're actually pumping lymph fluid. Now lymph for the gut drains to the upper right side. Okay, good, then you can relax. Feels pretty good, doesn't it? I know, but understand, now you can do this at parties too. 4 times the amount of lymph that you do have blood, that you do have blood. Okay, now lymph for the gut drains to the upper right. Lymph for the chest, lymph for the gut drains to the upper left. Lymph for the chest drains to the upper right. So now if you happen to see swellings over the right clavicle, you could say that that person might have had a chest cold. Okay, and you can do this at parties. It's really fun. If you see swelling over the left clavicle, you could say, wow, a little bit of diarrhea, little constipation, little upset tummy. Okay, that's physiology. But if you don't get movement of that lymph, toxicities grow. Where do you think over 90% of the breast lumps, tumors, cancers occur? In the upper left quadrant. Does that have to do with lymph drainage? Yes or yes?
Yes.
Huge. Does it have to do with sedentary lifestyle? Yes. Does exercise and movement 100% of the time show a decrease in cancer occurrence, in breast cancer rates? Yeah, and we're going to find out why too. Now here, under physical, chemical, or emotional stress, your body responds like it's being chased by a tiger. Okay? Now, if you're being chased by a tiger, do you want a fast heart rate or a slow heart rate? Fast heart rate, so heart rate goes up. Do you want a lot of available energy or a little? A lot, yeah. You want to run away from the tiger. You don't want to become lunch. Okay, so what happens is adrenaline, cortisol, glucose, all of these are produced under stress, under physical, chemical, emotional stress. So what does stretching and exercise do? It burns those up. The problem with this, cortisol, okay, its primary role is to downregulate insulin receptors. So what it does is it actually keeps blood sugar there. Too much blood sugar is called diabetes. Oh, elevations of blood sugar. Oh, so stress could actually be related to diabetes? Yes or yes? Okay, here's the crazy part. Cortisol, if you know, should everybody in the world have the exact same blood pressure? No, that's dumb. Okay, but now what happens is the medical world, okay, is actually making sure that everybody has the same blood pressure, so they'll give diuretics or beta blockers or, you know, anything. So it just forces it. What happens is if your body has a situation that you have to elevate blood pressure, let's have physical, chemical, emotional stress. Now, do me a favor, sit up nice and straight. Slide your body off to the side, just like this. Now, take a deep breath. Okay, now go back to the middle and take a deep breath. It's easier to breathe like this.